right, good afternoon, everyone. I'm Heather Macalma. I'm a second-year occupational medicine resident. And I chose this article, Return to Work After Burn, a prospective study, to answer some questions that came up for me when I was seeing patients rotating in the burn center earlier this month. And I thought it would be a topic that is accessible and kind of interest in multiple areas of specialization here at the center. So in occupational medicine, returning people back to work is a central focus and goal of managing injuries. And the reason why we focus on it so much is because it's important to the people's health and well-being, and it fulfills a lot of their needs, including psychosocial needs as well as financial needs. And so in trying to return people back to work after a burn injury, there can be many different obstacles. Early on, after an injury, physical limitations tend to be the main problem, but in the later phases of injury recovery, psychosocial issues tend to predominate. So this study had three main objectives. It was intended to explore the predictors associated with time to return to work and predictors as well associated with not returning to work. And they wanted to identify what differentiates the groups between who return to work and those who do not in terms of their health-related quality of life and also mental illness. So this study was designed as a prospective cohort study. And the population they focused on was adult burn patients who were hospitalized in a burn center in Sweden. And these workers were to be employed at the time of injury or at least engage in full-time education intended to put them in a job at some point. And so they followed these workers for 12 months after their burn injury and then did an additional long-term follow-up somewhere in the 2 to 7 year range after their burn injury. So for their inclusion criteria, they had to be admitted to the specific burn center ICU. They had to be adults 18 years or older, Swedish speaking, to be able to follow their kind of questionnaires. And they couldn't have any documented cognitive disabilities. And in terms of their burn injury, they were included if their total body surface area of their burn was involved 5% of their body surface area. And for reference, 1% is estimated by the hand. Alternatively, they were included if their length of stay in the ICU was at least 1 day. They then excluded anyone who was older than 65 years at the 2 to 7 year follow-up point. And they excluded them if they were not employed or in a full-time vocational educational type of program. They did a very detailed analysis with lots of predictors included, and they focused on 6 main areas of categories of measures. So they looked at injury characteristics, socio-demographic variables, work-related variables, and psychiatric disorder and personality disorders, which they captured this by doing a structured clinical interview for DSM-4, which was the diagnostic criteria guide at the time, 2000 to 2007. And they were looking at Axis 1 and Axis 2 psychiatric disorders. And then for post-injury measures, they looked at their generic health-related quality of life using a standardized questionnaire called the EQ-5D. And they looked at burn-specific health measures using the BSHSB questionnaire. For statistical analysis, they looked at 2 sets of outcomes. They looked at return to work versus not returning to work, and they looked at the time to return to work. And they measured the differences between groups using a student's t-test, chi-squared, or Fisher's exact test as appropriate. And they produced predictive models. They did univariate regression first to identify individual predictors, and then did stepwise regression for the variables, which were statistically significantly different based on a p-value of less than 0.10. And then any remaining variables at that point were then tested in the final model. They used adjusted R-squared or the Nagelkerke R-squared to explain the variance in their final model. So for their results, using their inclusion criteria, they were initially able to enroll 112 participants. And then when they applied the exclusion criteria, they were left with 70 participants. And then those who were able to be included in the final analysis after having had a 2 to 7 year follow-up, they had 58 people. So here's one of my AI generated pictures. Mostly, I added a few features to just kind of distinguish the different categories. But of the 58 who were in the final analysis, about 2/3 were able to return to work, so 39 participants, and 1/3 was not able to return to work, so 19 people. Of those who returned to work, the majority of them were returned to their full job, and then a smaller amount were able to return to work, but under some sort of job modification or to a different job. And then there were 2 people who were studying full time for vocational education. Of the third of participants who did not return, who were not returned to work, sorry, of the 33% who were of the total final analysis who were not returned to work, most of them were on sick leave by the time they were followed up. There were 5 who had accepted a disability pension, 3 who were unemployed, and 1 who took an early retirement pension. So for here we have table 1, which shows the descriptive statistics with regard to the different predictor variables. And then here's the rest of it. It's kind of hard to read. But again, they used univariate regression to try to identify which predictors or variables were statistically significantly different. And so to try to simplify those findings, which predictor variables showed a statistically significant association with the outcomes, I summarized them in this chart. So broken down in terms of time to return to work and not returning to work. So for those who, for time to return to work, there were multiple injury-related variables which showed an association with longer time to return to work. That included total body surface area of their injury, the total body surface area of full thickness or 3rd-degree burns, whether or not the injury was work-related, and their length of hospital stay. In terms of the socio-demographic variables that they tested, only living alone was associated with longer time to return to work. And in terms of the psychiatric disorders, most of them showed an association. For their final model, the variables that they kept were length of hospital stay, living alone, and having any personality disorder. And then for the outcome of not returning to work, they showed an association with just length of hospital stay, but for the psychiatric disorders, again, multiple different variables showed an association with not returning to work. And so for their final model, they included having any anxiety disorder, any substance use disorder, and they found that there was a best fit model when they looked at having any psychiatric disorder in the 12 months prior to injury. Okay. So in terms, now looking at the factors that were associated with the time to return to work for the 39 participants who did, 27 of them, or 70%, were able to return to work within the first year. 9 participants returned to work between year 1 and 2, and then a minority of the participants returned to work beyond the 2-year mark. AI generated this picture, kind of copying, pasting the data from the article, and I think it somewhat misinterpreted the numbers that were input into it. And I thought it was a little bizarre, the picture of the visibly scarred burn survivors. Okay. So now looking at the generic health-related quality of life measures for these 2 groups, they found that there was lower generic health-related quality of life in the group that did not return to work. This was seen using a few different ways of breaking down the data from the EQ-5D questionnaire. So they found that the non-return to work group had lower quality of life compared to the return to work group at every time point of their follow-up and in every domain that they measured. Also, they found that the group that did return to work had overall higher health-related quality of life, and this approximated that of the general population in Sweden. One other thing they found looking at this was that the group that did not return to work had more psychiatric illness at their long-term follow-up. Okay. So this figure is looking at the burn-specific health scores, and they found that it was higher for the group that did return to work, and this was they're depicted in the dark in the black compared to the non-return to work who are in light gray, and they found that this difference was noted at, again at all time points and in every domain that this particular questionnaire looked at. Okay. So in exploring many different predictors and variables, I think this study brings up a lot of different points. First, it is notable that the length of hospital stay was an important predictor of whether or not someone returned to work after their burn injury and the time that it took them to return to work. This suggests that length of hospital stay can be a proxy for burn severity, which is sort of interesting from a clinical perspective because usually we grade burn severity or make prognostic determinations somewhat on clinical findings like the depth of a burn injury in terms of how many layers of skin that are affected or the total body surface area. This study was also the first one to look at the influence of personality disorder on the time to return to work. The study found that after 2 years, return to work rates are not likely to change if you keep following them longer than that. And this study also found that the risk of not returning to work is increased with their having a lifetime or recent history of any mental health disorder, particularly anxiety or substance abuse. And so highlighting how the impact of any sort of pre-existing mental health condition. And lastly, I think this study showed that the generic health-related quality of life, there's a significant difference between the groups who don't return to work versus those who do not return to work. It's interesting that those who are able to return to work are end up being very similar to the general population. Whereas those who don't return to work have decreased quality of life, though it can probably be deduced that there's a bidirectional relationship between not working and having lower quality of life in burn survivors. So in conclusion, the key findings of this study are that most people who return to work do so within the first year, and they generally have a higher quality of life comparable with the general population at long-term follow-up. And the other overarching finding is that length of hospital stay and mental health disorders are an important predictor of time to return to work and not returning to work. So the strengths of this study that I found were its longitudinal follow-up using a very comprehensive analysis in a well-defined population, as well as using standardized measures to calculate the predictors that they were looking at. And I thought another strength was its use or identification of psychological factors in terms of people's return to work following this injury. Its limitations were that it had a small sample size, a high degree of unexplained variance. They didn't include a lot of detailed employment data to be able to make better, draw better conclusions about the differences in the functional capacity of those who did versus did not return to work. The authors also identified a few additional limitations in terms of the study not controlling for external economic factors, which could potentially influence someone's return to work. And then because this study was done in Sweden, it may not be easy to generalize this data based on their workers' compensation system to the US or even just generally outside of Sweden. And then lastly, they use some self-reported data, which can introduce a recall bias. So I'm happy to take questions, or I've got some questions too for the group for us to discuss.
I tried to read through and see if I could find it, but do you know if they asked if they just returned to work in general or if they returned to the same job they had prior to the burn?
They did ask if they returned to work on full duty, or whether or not they had to modify their job in some way, or whether they were moved to a different job.
Okay.
So they did distinguish that in their in the group that was returned to work, and most of them returned to work on their full job.
Yeah, okay, that makes sense. Relatedly, I would have liked to see them actually include some work-related variables because it says that there's 20 burns that were occupational. So, and given that it was like 5% of the total body surface, I would anticipate that that's like sort of a more severe burn and likely associated with some trauma. So if that happened in the workplace, is that going to be harder for them to also return to work? That was kind of just one thought I had. And then I would have been curious to see like how many of these people were actually going through like therapy too, not just like in the hospital, but also mental therapy would have
Yes.
probably helped. I would anticipate that that would be a predictor of return to work too. So
Especially because that was kind of a focus of this study, was how does mental health impact someone's return to work status.
Yep.
yeah,
And so
thank
it's a
you.
huge confound that they
Yeah.
didn't have some assessment of what are the resources that you are using right now
Mhm.
to address your mental health.
Yeah.
Right. And so that was one thing, is like, why are they making, drawing conclusions about that when they don't even ask, what people are doing? Right.
Yes, that was certainly a limitation that I saw too.
Right. Other.
A couple comments online. Micah asks, length of hospital stay was an important predictor. Did the study, by any chance, mention if all the participants were treated at the same hospital?
Yes, so every one of these participants was hospitalized in the same burn ICU. There's 2 burn ICUs apparently in burn centers in Sweden, and so they specifically looked at this particular one.
And Kevin has a comment, bunch of work that I don't understand, but that's okay. For the time to return to work models, it appears that they used linear regression, which is not the best, since the outcome is a time to event. Sometimes in these situations, people log transform the outcome variable and use linear regression. The better way to do it is a survival model, like Cox proportional hazards, like I could have easily told you, obviously.
That's really your question.
Yeah.
Yeah, I mean, you taught me. Yeah.
So I appreciate the statistical input. There was some point where there was log transformation of some data. I'd have to verify what there were a couple of variables that had to get log transformed, but in terms of knowing the better statistical measures, I defer to other expertise.
Yep.
Following up on that, did you happen to follow how they chose variables to put in their multiple regression?
So it seemed a little bit, let's go back to this, but it was, I don't know that I would have chosen all these same variables, but for their injury characteristics, they looked at mechanism of injury, again, the total body surface area, how much was full thickness burn surface area, the length of hospital stay, whether or not there were hand and facial injuries, their age, and the time since their injury.
Right, how did they choose which ones got in the model?
I think they looked at, they did, when they did their regression models and they kept testing to see what had a better fit. I think that's how they determined what stayed.
This looks like statistical model building as opposed to epidemiological, and they were looking for p-values of 0.1 or better. One of the challenges here is we got small sample sizes.
Yes.
So you naturally end up throwing things out left and right when that happens. In this case, they don't have that many variables, but do you really think that there's no relationship between some of the other, especially behavioral, psychiatric, psychological outcomes? They're not in the final model, but should they have been?
And again, there were multiple different versions of psychiatric disorders, like whether they were depression, anxiety, substance use, and then the different personality disorders. So I'm not sure it was, I'm not sure that that it made perfect sense which ones they ultimately chose, except for the way the model looked statistically.
I guess what I'm getting, so this is a big picture issue, at least my view of it from epidemiological studies as a whole. And applying to this one, if we look at the differences in table 1 in between various psychiatric disorders, some pretty significant differences. Anxiety disorders, substance use, any psychiatric disorder. Affective, they didn't break out depression, but you could see that one's also got a significant difference in all probability. And what I'm getting at is when you do them, at least from an epidemiological perspective, when you do multivariate modeling, you want to have things which are meaningfully factors in the final model, even if the stats don't support it because you have small samples. So I'm having issue with how they did it. Really with it.
Good.
That's just me.
Good point, Dr. Eggman. I would agree with that. Yes.
I think I have a couple of comments than just questions. It wasn't significantly different between groups, but in the return to work group, there were a higher percentage of work-related injuries. And I feel like you may have a better opportunity to return to work if the injury happened at work, your employer is motivated and has support programs to help you recover and come back to work. So there may be a little bit of a resource availability, versus being injured at home and then returning to work. And then the other was maybe just a plug for anybody interested in our advanced total worker health seminar next fall. I think the interactions between injuries and health-related conditions are pretty huge.
Absolutely.
It is for obesity, but I hadn't seen this related to burns, but it just suggests that it's not just the injury that's happening. The workplace has opportunities also to protect people from stressors and to reduce the prevalence of psychiatric problems or anxiety problems. And work can cause all of those sorts of things as well. So it isn't just people who are burned should also have psychiatric support. Is that the workplace before they're injured should also be addressing well-being and health because they interact really powerfully with an injury. So people are more vulnerable to worse outcomes for injuries when they have a psychiatric illness or other struggles.
Another
Definitely.
comment and then a question. So that folks know because in the US, the workers' compensation costs are more directly linked to the employer, and in Europe they're insulated. Europe is typically about 30 to 40 years literally behind the US in terms of return to work programs and all those sorts of things. Because the employer is insulated, so the state pays it for the most part. The question I have back to the bottom line here is what do you think is going on regarding the burn severity issue versus the return to work, non-work, return to work status and the behavioral issues or psychiatric issues?
I mean, I think together with the severity of a burn, when you're out of work for a long time and you're fixated on it, and any sort of pre-existing mental health condition certainly has some interplay with how you perceive that injury and how likely you are to be able to return to work. So I think they're not isolated issues.
You pointed out the TBSA and the full thickness are, they're different, but they're not a lot.
Yeah.
Probably a factor against small sample size. Sorry.
Oh, here.
Had that table, yeah. But the length of stay is markedly different. Stay is related to the psychiatric.
I think that can be part of it. People are sometimes feeling not ready to take care of their own injuries, even if by more objective physical measures they may be able to. There may be psychological reasons and home support reasons, for example, that may keep them in the hospital longer.
Mental related and to the outcome of return to work.
Probably.
So it's a potential confounder and effect modifier.
I think, yes.
Got a comment from Barry online. He said, I may have missed this, but was there any mention of where the burn occurred? A third-degree burn will affect you differently based on where it occurred.
They didn't break that out specifically. One of the injury-related variables that they collected was whether it was a hand or face injury. So, but they didn't define it in more detail at like leg or arm.
Hand and face ones didn't differ.
Correct. So I have some questions, but if let's see. So kind of for the group, so how would you think we can use these findings to increase return to work rates? What should we focus on?
Think focusing on mental health, trying to get early intervention prior to injury. So maybe that would be the best way, but.
So like the total worker health type of focus on.
Yes, yep. And to,
Yeah, I mean, given that if you have a mental health issue, you have a higher propensity to be injured. You might want to address that before the injury as opposed to part of the return to work process, which I think has already been kind of stated by others. But yeah, but I think for me, there are some things that you might change or want to focus on a little differently, and I agree with your statement about that. But I think some of the concerns that we brought up about the data and about the study make me hesitant to change a whole lot, because I don't know exactly what the effect might be if we did. You know what I mean?
Like you want to be better convinced before we go and
Yeah.
change our standard of care.
Yeah, I mean, I'm convinced that something needs to change, but I'm not convinced of what per se exactly. Now, that's the good thing about research. It's never finished, right? So there's more that needs to be done. But that's kind of my feeling is like, I don't know what the specific change should be. And you'd have to do a clinical trial or some sort of, approach to verify and to have comparisons. And this was really more exploratory in my mind than a controlled trial type approach. So.
And I have more questions, but I don't want to run over.
Here we go, like 3 more minutes.
All right. So kind of along those lines, if we were to incorporate kind of mental health support, how do we do this?
I think one of the big things would be to establish like a mental health screening early, especially like in hospitalization stay. Once someone's stable enough, I think to screen to make sure that you're not missing something.
And I will say that the burn center here, they do have quite a bit of mental health support. They have some dedicated social workers who are specifically incorporated into their burn team to screen when somebody's kind of stable enough, and then they're followed on as an outpatient as well, specifically like in a kind of combined multidisciplinary setting. So one question I had was, how might the findings of the study apply to other traumatic injuries, or could we?
On the prior one, can I ask, is there a system, because I think I hear Nicole, is there a systematic approach where they really look at every single patient? Because if you don't, there's all kinds of people who, they look fine, they're not fine.
I couldn't speak specifically about what screening questionnaires and their method of detecting psychosocial risk issues. on the inpatient setting. So I don't know. But I think they would follow whatever is protocol for their specialty.
Build it into kind of the physical therapy, because I know like after you have a traumatic injury, you do go through PT as like a part of your recovery process. Could you build like mandatory like sessions with a social worker or a therapist or something into that? So that even if they're like lying on the questionnaire or something, they're still getting the support.
And I do think that there is an effort to try to like integrate these services so that people who are physical therapies specialized in burn care also are co-located with people who do mental health support for and they understand burn injuries and how it impacts people. And this is not necessarily true throughout all places that do wound care, because not everyone has the luxury of being able to be in a specialized center. But that would be helpful, I think.
Anything else on this one? All right, good job, Heather. And when you're got all you put in a pocket, whatever, I'll manage
Maybe go pick up Nala from the airport. Any chance you'll be here in person or maybe online for this presentation on Monday?
No, I could do it online maybe. Bye. Okay, I can try. Yeah.
Yeah, like they have seamstress.
I am definitely interested. More of the time.
And they're probably really fast. Yeah, a couple of days.
All right, can everybody hear me okay? Yes?
Yep.
Okay. So I grew up pretty close to the Targhee National Forest in Idaho, about 4 hours north of here. And when I was little, I spent a lot of time with my grandpa and my dad cutting down trees so that he could stock up for the winter and get wood for his wood burning stove. So I have some experience with logging and with chainsaws, and I saw this article and I thought it would be an interesting thing to discuss with everybody, especially because I don't know many people that have experience with logging, so I thought we could have a good discussion with this today. The article that I chose was, excuse me, Human Factors Affecting Logging Injury Incidents in Idaho and the Potential for Real-Time Location Sharing Technology to Improve Safety. This is a study done by Soren Newman and Robert Keefe out of the University of Idaho. Robert Keefe has actually done a lot of research in this particular area, and he cites a lot of papers that he has done in this article here. So I think it'll be good to get some perspective on that. So this study particularly aims to characterize the current perceptions that loggers have about these location sharing technologies. And they wanted to understand the loggers' views on hazards that contribute and the human factors involved, especially because there's so many human factors in this dynamic environment. They wanted to evaluate the technology-based solutions available. They wanted to assess the loggers' views on this location sharing technology for safety and solving some of the issues that they're seeing with accidents that are happening. They wanted to identify hazard scenarios and use the loggers' personal experiences to figure out applications for these location technologies. And then they wanted to develop field experiments based on these situations that these loggers provided. How many of you have had a long day? And those online, I'm sure you're raising your hands too. I don't think there's a person here that hasn't had a long day. I can say that even though we've had a long day, at least you're not dead. Loggers have logging in general is considered to be, depending on how many accidents are done in the other top 10 dangerous fields in the US, the #1 most dangerous field today. In 2016, there was 136 fatal injuries for every 100,000 workers. That doesn't seem like a lot, but that amounts to 91 deaths in 2016. And there's a lot that goes into that. The researchers took Slappendell's research. Slappendell accumulated 20 years worth of logging injuries and fatalities and grouped them into 4 different groups, attributing to where these injuries could come from. #1 is personal characteristics. Those are things like your judgment and your decision-making, your skills and your techniques, your experience, education, training, and your age. #2 is machinery, tools, and equipment. That's things like chainsaws that contribute to vibration and noise, chainsaw kickback, which is when your chain snags in the log and whips up. And then there's the forest machine design, protective equipment that you're using, and the maintenance of those things. #3 is the work organization. This is how your company is structured, whether that is piecework or salary payments, whether you're contracted or subcontracted, the size of the company, and your task demands, as well as the mechanization available to you. #4 is the physical environment. So that's things like the climate, the lighting, the terrain, and the flora involved. There are other things, other contributing factors like your fatigue, because as the day goes on, you're just going to get more and more tired. And that is especially true with anyone who has experienced doing manual labor for 8 to 12 hours a day, which is their standard shift length. There's also the reduced sleep because there's variable shifts. So that means that you could be working night shifts, you could be getting up early and commuting, because these jobs are out in the middle of the forest in the country. And most people don't live out there. So that involves a commute, getting up early, staying up late, after having worked a long day or looking forward to it. And then there's the pace and the intensity of the work, because it's not slow paced. They have quotas that they need to meet. And depending on the size of the company or the outfit, that's a lot of work for one guy. So they have to take all of this into consideration. And the question is, do we as safety professionals even care? Because right now we're in a comfortable, cozy room and not wielding chainsaws. So why do we care? Well, we need to understand that our expertise only extends so far. And paying attention to these kind of things allows us to better use the expertise of others to further build the knowledge base and help us to design better experiments and to understand the situations that hurt people. Because ultimately, that's what we're here for, is to help people to be safe. This paper discusses a few things that have improved the basic safety of loggers over time. And one of those things is actually insurance companies, believe it or not. Insurance companies have minimum requirements for safety to even be insured. So as much as people don't like insurance companies, they've done some good, and we should consider that. Another thing that's actually been very beneficial is the mechanization of logging over time. Because if you put somebody in a cab in an isolated space controlling a large piece of equipment, they're a lot safer in there than they are wielding a chainsaw down in the woods where they can get crushed. The issue is that though the number of injuries have gone down, the intensity of those injuries has increased, because now you're moving large pieces of equipment around and there are still people nearby. The issue with logging, especially in Idaho, is that about half of those are cable logging. And that is done on slopes greater than 40%. And if you're putting large pieces of equipment on a steep slope, it's not really a good idea. So they don't really have access to that. Most of the tree cutting in these cable logging scenarios are done on the ground by hand fellers, people with chainsaws. And they have different crews. They have rigging crews that'll hook up the logs to the line there, and then the line will drag those up. And I think we can all see the issues with dragging large pieces of wood up the mountain and then hoping that they stay on the cable. Well, we've got men with chainsaws downslope. So these relatively unprotected ground workers, combined with heavy equipment and steep slopes, is a breeding ground for these hazards and these accidents. And one of the things that is a big issue is these not seen injuries. The heavy equipment operators don't see somebody, they've had a long day, somebody gets crushed, somebody gets pinched, somebody gets hurt, and it's bad. So the things that they're trying to come up with are, how can we prevent that? And one of the things that is discussed here is this global navigation satellite system radio frequency technology. So these are location sharing technologies. And one of the things that they discuss is that when few trees are present, a 2.5-second interval is adequate to track equipment. So they ping the location of equipment every 2.5 seconds, and that's sufficient for everybody to say, okay, that's where that piece of equipment is. We're going to stay over here. We know where everything is. One of the statistics that they showed was that workers spend 23% to 53% of their time in hazardous areas. So this is either near large pieces of equipment or in the trees where people are cutting trees down. And in an area where there's lots of trees, we need to consider how that affects this location sharing technology. One of the things that they note is that as you increase the amount of objects in the way, it introduces a lot of positioning area error, and the radio waves are affected by the canopy density and the topography. So that's the positioning of the landscape, the positioning of the equipment, the positioning of the trees in the way. And so they don't recommend using this positioning technology for fine location identification when there's a lot of trees around. And one of the things that they discussed was geofences. So these are coordinates that say this piece of equipment is here. So if you're within a certain distance from that geofence or within that geofence, you're getting a ping that says, hey, you're in an unsafe area. So if you put the workers inside of the forest there, they're a lot more difficult to see. And one of the things that hasn't been studied and is the purpose of this article is the opinions of these workers and how they think that these location sharing technologies can be used to help prevent accidents. So the article discusses how they did interviews and surveys concurrently. These are the interview methods. The interview methods they pulled from the Idaho Logger Education and Advanced Professionalism class. So the participants from 2004 to 2015 for that class, they chose 75 out of 677 of these LEAP participants. And there are some benefits to pulling from one source like this, and I've listed them there. That you know that they have relevant experience. They have the accreditation requirements, and then they're a targeted group that has the knowledge that you need. The issues with that is that there's limited diversity because they come from a select group of people that is interested in programs like this. It's a choice. And normally when you choose to sign up for a program, you tend to fit into a group of people that wants to better themselves, wants to improve themselves, and takes their job very seriously. There's selection bias that comes with that. And there's potential homogeneity because especially in Idaho, northern Idaho, where this takes place, there's not a lot of diversity already. So you'll actually see later on that that does become a big issue. And if you take into consideration that they had a pool of 677, chose 75, and the total loggers that are available and active in Idaho in that time were about 2,500, your sample size and your diversity and your options are very small. So that's one of the issues that I saw with this article. They ended up doing 41 interviews to reach theoretical saturation, which they defined as no new ideas coming up when they were having an interview. So they interviewed people until they had that theoretical saturation. And then there were interview topics that were discussed there, and I will let you read that. The survey methods were sampled at 6 different LEAP workshops from northern Idaho to southwestern Idaho. And the survey was focused on PPE use, factors contributing to injuries, hazardous situation, and demographics. They interviewed or surveyed, excuse me, they surveyed 272 more loggers and had them answer questions on a scale of from 1 to 5 about how frequently or how likely it is that a certain situation would cause an accident, with 1 being not likely at all to 5 being very likely. Some of the contributing factors that were documented that caused these logging injuries were forest and landscape conditions with a mean of 2.47. Structural drivers of work conditions, that's things like pressure to harvest as much and as fast as possible. That one is actually the most likely to cause accidents according to these loggers. It's about 3. Loss of sleep due to travel time is 2.75, and fatigue, and on and on. The conditions that affect the ground workers that were most likely to cause accidents were slips, trips, and falls. The rigging crew members getting hit by swinging chokers, so that's the line that comes down that they hook the logs to get dragged up to the logging yard. Then at 2.22 was pinned by a felled tree, so that is a tree that falls after being cut all the way to the ground. And then a snag or a live tree is a tree that either gets snagged on another tree or a tree that is falling currently. So a felled tree is one that's already on the ground and rolls on top of the logger. And a live tree is one that's on its way down, if that makes sense. The conditions and injuries for equipment operators were a lot less. There was only 1. And that is workers hurt while working on the equipment. That's either operating it or doing maintenance. So the barriers and prospective uses for this are as follows there and listed. So the prospective uses are the supervision and productivity, scale of operations, monitoring of ground workers and machine operators, and focus and distraction was a big issue, was a big thing that people were worried about. Is this actually going to be helpful, or are people going to be looking at a screen more than they're going to be paying attention to things around them? And another thing that was beneficial was working alone and for emergency response. This picture right here is showing how many people or how much people say that they carry two-way radios. And there's a lot of them that say they never have a radio on them. And if they don't have a radio on them and something happens, there's no way for them to get help. So one of the potential uses for this location sharing is emergency response and saying these people haven't moved in a while, we should go check on them and make sure they're okay. So that other picture there is just some quotes from people expressing their concerns about location sharing. Whether it's a distraction, they think it's unnecessary, the cost of it, and all of those things. So the key benefits for this technology that were established by their conversations with these workers are they're useful for high priority situations. So they can help workers to get out of the way of objects or get out of situations where they could get really hurt. You can make a safe distance and you can maintain a safe distance in cable logging. So make sure that they're out of the way of trees as they're getting dragged up to the yard. And then you can improve the visibility for equipment operators. They have a lot of things going on, a lot of moving parts. And as the day goes on, their situational awareness is going to flag and is going to falter. So if they have another safety net that is reminding them or warning them when people are nearby or are within the geofence, then they can perk back up and pay attention. It'd also be useful for emergency responses, as I've discussed before, as well as addressing hazardous conditions and preventing rollovers by making sure that heavy equipment operators stay away from areas that are too steep. Because you can put a geofence up and say, don't go past here or you're in danger of rolling. And that could be dangerous. The loggers expressed concern about this becoming a distraction, how they were going to pay for it. Privacy was a big one, actually. are the companies going to use this to monitor us and abuse that access to our position? And they were wondering if it's going to be usable. One of the things that they said they would like to do in the future would be to design a user interface that would minimize that distraction and address that concern. And they discussed the unwillingness among older workers to adopt this. Because one of the things that the paper discussed was that most of the loggers that they interviewed had 20+ years of logging experience, and most of them were over 40. So they didn't really have a perspective from a younger generation. And it was discussed in the article that a younger generation would be more interested in adopting this kind of technology and using that to improve safety, where these older workers seem to be pretty set in their ways and confident in their abilities to do it themselves. And they wanted to be able to address the integration of this and avoid increased production pressure by using this to facilitate more effective and efficient work. Are there any questions for me?
I've got a couple of comments from some folks online. Thalia says, from what I understand, language barriers are also a factor for increased risk in logging. And then Barry said that he can attest to this with personal experience. The operations he's seen and worked as part of quickly learned to rely on very primitive sign language.
Yes, yes. That was addressed partially in the introduction to this paper, how turnover is pretty frequent, and a lot of the times they just get contract work. They'll pick up anybody, and then they'll say, hey, come work for me for a little bit. And so you have a lot of different ethnicities, especially in Idaho. And so you've got a lot of people that have different cultures, different languages, and they're rotating through pretty constantly. And so that is a big concern, and I'm grateful that that was brought up. Yes.
You mentioned at the beginning that like insurance kind of helps regulate like all the safety stuff, but are there any like regulatory bodies that do that, like OSHA, or are there no like overarching bodies that?
I am not sure about specifically logging bodies, but because these are outfits that are companies and are subject to federal regulation, then OSHA and those regulatory bodies would be involved, because there are conditions and requirements that do need to be met by companies. And so logging bodies, I'm not particularly sure, but definitely the overarching federal regulatory bodies. Yeah.
Real quickly back to communication. The Associated Oregon Loggers shared with me that there's no national standard for signaling messaging. So they'll send auditory signals, but in Idaho, those signals might have different meanings than in Oregon or in Washington or back east. So there's an opportunity in the industry to standardize signaling.
Yeah.
And then the other comment is, I know in trucking, they've had a hard time getting fatigue alert systems based on eye closures because there's so many false positives.
Yes.
So the workers try to turn off the systems or ignore them because they're so frequently going off.
Yes.
I think that would be one really big challenge in this area, is if a proximity indicator is going off all the time because the workers are rigging and are always under.
They're always there.
Or near the rigger. So I think they really have to work out like that threshold for sending a proximity indicator.
Yeah. That's a really good point. Thank you for bringing that up.
Yeah, so you've got to have, it's like car alarms. I don't know that there's ever been a less useful alarm system ever, because almost every car alarm is a false alarm. And so in this case, there's great potential to improve situational awareness and save lives, but they've got to get that done in just right.
And the last thing that you want to do is make sure that they can't turn it off, because then they just won't wear it. And then it's pointless and you spent money for no reason. So that's an excellent point. Thank you for bringing that up.
Related to, oh, sorry.
Please.
I think you were first.
Okay, related to car alarms, I also would be concerned about like reliance on the proximity, because if you maybe are on a job where that is a capability and then you go somewhere else and that's not there, and you might be like
Mm.
relying on that
Right.
signal, that could be a significant safety hazard.
Right. So you would be worried that they would become less safe
Yeah,
because they
mainly-
have that safety net.
Yeah, exactly. And they are maybe their brain is less attuned to needing to pick up on small things or be aware of it because the system is
Yeah.
potentially doing it for them. Like, for example, I have a lot of friends who do not know how to back up a car without the beeping.
Yeah.
Or they run into things because they're anticipating the beeping and then there's no beeping and all of a
there's nothing.
sudden they're, yeah, exactly.
Yeah. Yeah, I've noticed that myself, that I rely too much on my backup camera now.
Yeah.
I definitely agree with that. That's a fantastic point.
Appreciate you, doing an article on forestry, because it's been a while since we've talked about the subject. And by the way, Rail is the first that ever standardized stuff, including all the way down to time zones, because they had to. But my question is, if you look at their aim, what they really were trying to do out of the gate,
Mhm.
where did they hit and where did they miss and why? You alluded to it, but I want to make sure.
Yeah. Let me actually go back to that slide if I can find the mouse here.
While you're doing that, I mean, I'll pitch that their aim was very broad.
It was very broad. And I think that there's benefits to doing that because you can't miss if it's broad. But at the same time, it kind of it defeats the purpose almost. Because if there's no specific aims and there's no specific target that you're trying to hit, it's kind of like, why are you doing it?
You hit one of the weaknesses, which was it is unable to address young workers.
Yeah. And part of that reason is I think because they pulled from such a small pool already. They chose 75 initial, and then a lot of those didn't even agree to be interviewed. And so that's how come they ended up with 41. Then the total pool that they were pulling from was 677 out of almost 2,500. So you're missing out on more than half of all the loggers in Idaho. And while it is an aging group, because there's not very many people that are going into logging, obviously, there's cushier, comfier jobs that pay more. That is a big flaw, was their inability to address and get some views from younger workers. As for what aims they hit, I think they did a good job of characterizing the current perception of older workers. They got a lot of perspective from older workers that thought that they could do it and they didn't need any of that fancy technology, but there's nothing from younger workers. They had one logger that was a woman and the rest of them were men. So they have the current perceptions of older male loggers. So I think that that worked out pretty well. Is somebody
That's very
controlling this? I'm not doing that.
Yeah, I just pulled it up because we couldn't see it on.
Okay, I was starting to freak out there
Sorry.
and then taking over.
Another main point, I know we're running out of time. What about when you get into the types of logging operations or characteristics? You then also lose the power, right?
Yeah.
Loading and trucking 3 people, helicopter 1, horse 1, site prep and rehab 1.
Yeah. And that's a fantastic point, that you're really not getting perspectives from more than 1 or 2 people that have experience in an area. Because there's not 500 people saying, I've done helicopter logging and this is where I think that it would be really useful. You've got one guy that says, yeah, I've done it before and I think it's a waste of time. So
Good study.
it is.
You gotta know.
Yeah, it was a good thing to read. But I think that they did evaluate the technology-based solutions. They had a good discussion with everybody about that. And they identified some hazard scenarios, but there's a lot that are missed by people just not having experience in certain areas. And then they did mention a few things about field experiments that they could do, but again, they were very broad and not very targeted at all. So I think being able to take an article for what it is and appreciate the good things about it is one of the skills that we, especially we as researchers, need to get very good at. But we also need to be good at looking at what was done poorly, so that if we do a study in the same field, we can address those weaknesses and hopefully shore up some of the flaws. Any last questions? Great.
All right.
Thanks, everybody.
2 more Friday Journal Clubs left. We're getting down to the end of it.